Um, that is non-negotiable. That is not an
Mm,
option. It must be done. Like I say, you only get one you, and
mm,
life expectancies. With modern medicine, they should be going up, but in America, they're going down. We're
that's
working
crazy.
ourselves to death. Working ourselves to death, and for what? I have
Mm,
never had a dying patient say to me, "Man, I wish I had worked more." Not even they don't even say, "I wish I had more money." They say they wish they had more time.
yeah.
More time. Your kids are only going to be little but so long. You're only going to, your parents are only going to be around for so long. You only have this finite amount of time. You have to use it wisely. And working yourself to death is not the answer. Even
Mm,
if you become a billionaire, it's not the answer.
yeah.
I think there's a way to profit and be successful, be, a powerful entrepreneur and still take care of yourself.
Yeah.
Well, most people who are doing that now, they want to focus on themselves.
Hmm. And I think we that's another mindset shift for us, to really look at that. Um, and, I think that self prioritization of your health will help out with all the things that we discussed throughout the podcast. That emotional release, that creating healthy boundaries, all helps to sustain the overall health. You can't just do one and expect to be good. You have to kind of do all of those things.
And
What was go ahead.
and I'm not just talking outside of my neck. Self-care, there's been research that shows that, doing regular self-care, and self-care looks different for everybody. There's
Yeah.
no blanket way. You know how to take care of you. I can't tell you how to do that. But self-care increases productivity and profitability.
Well, yeah. You know what? I read about that too. I don't know where I read it at, but because your routine of doing stuff in the morning, I know somebody else who does that, and they said they were they were like 10 times more productive by just focusing on that one thing in the morning and each morning, than trying to tackle a whole bunch of things during the day.
That's
And
because for me and for many people, it depends on who you are, if you're a morning person or night person. For me, the first thing in the morning is more productive. That's that
mm,
dopamine rush that is a chemical in the brain that gives a sense of excitement, the pleasure
mm,
center. And
yeah,
so, I have that big dose of dopamine in the morning, and that's my time to get my work done.
yeah, and then rest
hmm I
at,
can
at
take a
evening.
half day and get more done in a half day than most people get done in 2 days.
Wow. Wow. I, I, I think there's another term for this. I can't think of it, but is that like is it circadian rhythm or your cycle or whatever?
The circadian rhythm, that's more sleep.
That's more
That's more
sleep.
sleep,
Okay,
yeah.
that's something different else. But like learning your body's natural rhythm and cycle for when it's most productive. I forget the name what they call for it. Like and learning how to work in that rhythm. We weren't creatures. We as human beings weren't made to work 8 hours, a full 8 hours a day, right? On solving a whole bunch of complex problems. We're not wired that way, and so learning how to
That came
work
with
in the
the
way you're.
advent of the what do you call that? The assembly line. So
Hmm.
uh, people, we haven't always worked like this, and America
Yeah,
is really the only place that works like this. That's why
yeah,
America has poor health outcomes compared to other
hmm,
developed nations.
yeah, yeah. And there's something to be learned about that. If we want to be more productive, if you want not that I champion all capitalism, but if you want it to work better, you could follow other societies on how they get the best out of their employees and workers to increase more capital, increase more outcomes, better outputs, and so forth. Um, but I think we're just stuck in our ways as a country and a society. I don't know what that is, but we got a lot of growing to do. Um, what's some advice you would give to Black and Pan African entrepreneurs who are trying to do it all, but feel overwhelmed or stuck?
Uh, Doing it all is an illusion. It's not possible.
Yeah.
And there are tools now more than ever. There are tools you can use to mitigate all of that excessive work. I try to operate in my zone of genius, and that's the part I do. you know?
Yeah.
And then other parts, like for instance, social media, I have a person who helps me with that. VAs are now, virtual assistants are now more accessible than than ever. So I say, take some of the stuff off your plate. Find out what you
Yeah.
can delegate. There's something you can delegate. And, you might have startup entrepreneurs say, I can't afford that. I believe you can't afford not to because,
Mm-hmm.
you know, a VA from another country usually is pretty affordable. 10 hours a
Mm-hmm.
week to do some of the tasks that overwhelm you.
Sure is.
I just recently learned that. I was in the mode of, nah, I gotta do it. I gotta do it. Until I was like, I can't do all of this. And a friend's like, girl, here's what you do. Use your AI, okay, to help you with scheduling your post. Use your virtual
Mm-hmm.
assistant. Use the tools at your disposal.
Yeah.
That's how you keep from getting burned out.
Yeah.
And then after you do that, you can set up systems. Like there are things we do over and over and over and over and over. When you could have put it into a system, why are you doing the same talk when you could have made it a course where you pre-recorded? There are things you can do that you are doing too much of. A keynote speech, the middle
Yeah.
can stay the same. The
Mm-hmm.
beginning and the end changes.
Mm-hmm.
Hello farmers, you in front of the farmers today, so you speaking to them, but the middle stays the same, and in the end, the beginning and the end. So
Mm-hmm.
repurpose, reuse, be smart, work smarter, not harder.
I love that. I love that. That's some great advice. And I hope y'all caught that one. That's that. I mean, there's a whole bunch of good lessons in there, but I hope y'all caught that one for all of you aspiring leaders and entrepreneurs out there. Speaking of zone of genius, you got a lot of zone of geniuses. Yeah, speaker, your TED talk, your emergency superwoman, emergency room superwoman. You got a business. Let's. I know we spoke a little bit about the TED talk, but let's talk about the book and the business. Tell them about your book, and your business, and what's next for these things that you're doing.
Well, I teach courses on self-care, and so I wrote a book because, based on a lot of questions I was getting, and
Mm-hmm.
the people wanted it. So I started with that. I thought the first book I would write would be about the emotional flatline and things of that nature, but that's actually going to be the second. So
Mm-hmm.
I just saw the immense need.
Yeah.
An example being, I've had patients. This one patient in particular. I diagnosed her with uterine cancer in the ER. It's like, well,
Mm-hmm.
I need you to do these things. It's early. We probably can, she had a chance. She told me, I ain't got time to have this. I gotta
Mm-hmm.
do. And she started naming the things for the kids. And and she's not the only one. She's not
Yeah.
unique. So I feel like it's much needed.
Mm-hmm.
And I have to use my platform, and I'm a physician, and I'm uniquely qualified to speak to the demographic, so I wanted to do that. And so I feel it's important to me, and it makes me kind of light up to share that
Yeah.
information. And then secondarily, I just when I heard that 57 was kind of an age that ER doctors die. And I had a colleague
Mm-hmm.
die in the room, and another colleague just had a sudden death. And I'm like, maybe there's something to this. And I could think it's true because in ER medicine, there's that stress and then relaxation,
Mm-hmm.
stress and relaxation. That's not normal. That releases chemicals called cortisol, and
Mm-hmm.
that's only supposed to be released like if a bear were chasing after you and you got to run. It's
Yeah.
supposed to be very rare. It's not supposed to be every day at work. But that's what
Yeah.
happens when the ambulance brings somebody's in. And like for instance, the other day they brought a man in and he had his hand cut off. And I was like, oh my God, we got to figure this out. We got to help them out. You get into that stress mode. I want to do the best thing
Mm-hmm.
for them because when someone's hand is cut off, you only have a small amount of time to get it reattached. And I wanted to do
Yeah.
that because he was young.
Yeah.
So the stress of it all. And
Mm-hmm.
so I got into wellness and I realized something.
Mm-hmm.
And I've been a doctor for 20 years. Medicine is not about wellness. Our
Mm-hmm.
system here in America is a sick care system. It's reactive
Mm.
instead of preventive.
Yeah.
It's not healthcare, it's sick care. And then
Mm.
I'm looking at it and I'm feeling I hate to be like a conspiracy theorist. It seems like it's by design. I have never seen so many diabetic drugs on the market. I think somebody
Mhm.
anticipated we'd be fat and sick. 51% of Americans are obese, and that leads to a majority of chronic care or chronic illnesses. Like, for instance, obesity leads to arthritis, diabetes, breast cancer,
Mm-hmm.
heart attacks. We know that one.
Yeah.
But there's never, I don't see anything, public service announcements saying, let's get healthy, let's get fit. They used to have those when I was a kid. They
Mm-hmm.
don't talk about it anymore. Nobody's talking about wellness. And during the pandemic, I was just like, what's going on here? There are some people who beat it, there's some who don't. And the people who kind of had a baseline wellness, took better care of themselves, worked out, generally did all right. I found that more the heavier people were, they had no, a young person dying from COVID,
Yeah.
usually heavy.
Mm.
And so that's when it's
Yeah.
like, getting a healthy weight, because being the fat cells in your body, they're inflammatory. And so
Mm-hmm.
your body's in an inflammatory state.
Yeah. And not to get into the conspiracies, but I think yes, especially here, it's been designed that way. Like I think I remember reading studies about in Japan, like how long people live, and then the lifestyle of like how they have such a clean, walkable city, and then the nutrition that they eat. There's so many things in our food system in the U.S. that are banned in other countries. So the food that we're literally eating is making us sick. If you think about the pesticides that they do to make sure there's no worms on the product, and even if you're getting this whole vegetable, like if you were to soak it, like my wife soaks some of our vegetables in vinegar, right? Um, and you see all the mess that comes out of there, all those chemicals that seep into the ground and seep on the food, that's on the vegetables, and we're consuming that. And there's a certain amount of percentage that they could put on there that, not going to kill you, but over time, you keep sustaining it, eating it, that's not going to be good for you. It's going to cause something else later down the road. And I think, you know, it's just like you said, we don't look at the root care. Dr. Sebi was on to something when he's talking about
He was.
all these things. But we don't want the cure. We want there's no money in the cure.
Right, right, because we're a capitalistic society, and we have people who benefit from sickness and illness. Now, why would you cure diabetes if we can keep you sick with diabetes for the next 30 years and have you take medicine every day that you pay for, not cheap,
Hmm.
and you'll end up having to access services as well as your diabetes progresses, and we make money off of you being sick. Chronic
Hmm.
care is business.
Yeah. Where if you go change your whole lifestyle, food, diet, and so forth, and get away from the things that are inflammatory to your body, your body is amazing. It can cure itself if you put it in the right condition.
Exactly. But people aren't taught that enough. I tell my patients that, like, I can think of a patient that I had, and she was 300 pounds and 5'2". So, and she had knee pain. She was young. She was 25. And she says, Doc, my knee is hurting. What can I do? And I was like, there are medications we can give you and so on and so forth. I said, but the real issue, and I think a lot of doctors or the system is not comfortable having the real conversation. The real
Mm.
issue is your body was never meant to carry this much weight. And so your knees want to pop off and run away from you. That's why they're hurting. They're like, why are you doing this to me? It was not meant for this. It's not built for it.
Look,
And, I said, I give people practical things. I'm like, listen, walk to McDonald's if that's what you're eating all the time.
look.
Walk there. I saw her a year. I saw her a year later, and she was like 100 pounds lighter. She's like, nobody ever
Nice.
told me like that. You got to have the real conversation.
Look, look.
I'm going to be
And I think that's what
respectful and have the real conversation.
I think that's what our community needs. We need the real conversations, and we, I look at like back in the day, like my parents and my grandparents' parents, how they used to eat and how they used to like travel like 10 miles down to Uncle George's son's house because they had fresh watermelon and all of the home. We used to get the home. Grandma used to have us all over. They cook meals from scratch, uh, fresh out the ground cornbread from off the corner of the cob, grind it. Like I don't think we eat meals like that no more. Like
Yeah,
that's
we don't
that
enough.
fresh,
And
not enough.
since I'm on a wellness journey, I've been more into real food. Like, let's, cut up some vegetables. Let's get a chicken. I like to go to a farmer and get my chicken and my beef, and a lot of my vegetables, because
Yeah,
I think corporate farming and corporate raising of animals is for profits, and it's not good
mhm,
fuel. You may even
yeah,
find some of the people who run those companies don't eat what they're making because they know what's going on.
yeah. And they eat the fresh farm to table stuff. Like we was in Portland, they got a lot of farm to table type stuff out there, and I was eating berries and things from fresh off the farm to the table, and it just tastes different and it feels different too when you eat it. I'm like, okay,
It
we
has
gotta
more
do.
nutrients.
Hmm. Yeah, another testimony to this, that like my sister's vegan, and she jokes about making the family go vegan, but she was showing me like Lenny Kravitz's diet, and Lenny Kravitz got his own little community where uh, he eats nothing but fresh stuff off of his farm, and he got chefs that cook it straight off his farm. And you see how Lenny Kravitz look at his age?
Yeah, there's something to
Like,
it.
I was like, man, okay. If Lenny looking like this, he eating nothing but fruits and vegetables straight off the farm, I might have to give it a little try.
And I say that do what works for you, because, I can give you a negative point to just about any type of diet.
Yeah.
So,
So you
that,
gotta find out the one that works for you that you can stay consistent with, so
mhm,
that you don't yo-yo out of control with your diet and cause that flux in your body and shock.
exactly.
Yeah. So, speaking of, I want to go to community real quick because I'm curious to know, you know, I like building community, and I think we are like, especially in the Black community, we're like a very community orientated folks. So, what role does building a community or support system play in sustaining wellness?
I think we need to get back to that. As people get disconnected, we're more in our silos. I mean, you think about historically, the Black community used to centralize around, churches and schools. We don't really have that kind of community the way we used to, but I think we need to bring it back. I think we need
Yeah.
to coalesce around one another. And I would love to see a scenario like a Black Wall Street. I'd put up my shingle first. Um, you know,
But
uh,
so I mean, but yeah, I agree with you. But how can we as a community rewrite the narrative around that, and around strength and self care? How do we what's tell us, Doc,
yeah, I
help
know.
us.
you know, what we're doing now, having this
Okay.
conversation, bringing it to the people, getting outside. When the pandemic is over, we got to get back outside, meet,
Hmm.
network, fellowship. I was just at a wedding
Yeah.
this weekend, and I was like, it's nice to be outside. That
Hmm.
kind of thing, just simple stuff we used to do that is a lost art. Not and mix of digital and real in person
Yeah.
involvement. You hear about what I'm talking about, because what I want is for people to hear about what not taking care of myself can actually make me have a serious autoimmune disease, can kill me.
Hmm.
And tell your cousin, tell your sister, tell all the women you know in your life, chill
Yeah.
out, take a rest, clear your mind. You don't have to do
Hmm.
everything.
Yeah.
You don't have to do all things. And I say pick a set of things that are important to you. Like for
Hmm.
me, what's important, my church family, so God, my family, and the job
Hmm.
is way down there. Even though my job is important, it's just a job. It's a thing. It's not everything. And so prioritizing so you can make boundaries. I tell you, I have a percentage. I like to make 75% of my son's soccer games.
Hmm.
I'm going to be at every academic achievement. I'm going to be there for those. So if the job says, can you work? No, 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 my son's getting an award. I'm going to
Yeah.
be at that. And so those are my boundaries. Yeah.
Hmm. Yeah, I like that. You made me think of my mama too, because she's big in the church and part of her faith community, and for the people who had that faith community in them, I'm gonna add one more cliff note to this because I can hear my mama talking right now. I'm gonna tell you, yes, have your faith community. and it's good to have faith, but faith without works is dead. So you gotta put in some work too.
Oh, definitely. Self care actually is an active process. It's counterintuitive to most females. I mean, females are reared to tend to the home, make sure the home is
Mhm.
all put together. But we're at this weird place where we have women and we're working too, and so you're trying to do two things. And I would say your situation, your scenario, and if you're at a certain income bracket, if you don't have a house cleaner, you're just trying to kill yourself. You know,
Mhm.
if you are trying to wash your own car, there are things you can do to keep yourself from completely burning out.
Yeah, yeah, so true, so true. Well, I could talk to you all day long about this topic, but I don't do the Joe Rogan type podcast.
Insane. Those are insane.
Uh, and I appreciate the time. And you already gave me a lot of time being there. We started a little late. That was my bad. I apologize. But Dr. Buchanan, I mean, this has really been incredibly insightful conversation. And I think we all needed to hear that self care isn't selfish; it's survival. For anyone who's listening, anyone who wants to connect with you, where can they learn more about you? Where can they find you?
All right. You can find me at drbstrong.com.
Hmm.
And also at strongmedicinestl.com.
Yeah. Oh, also follow her on LinkedIn. I just followed her earlier today. She got a nice newsletter that gives some really good quick tips and inspiration, advice, all that good stuff. So I'm sorry, I had to plug that in there real
I
quick. I had to
appreciate
plug
that.
that in
So, yeah,
there.
if you connect with me, you'll get the newsletter. And if you go to the website, we'll send you the newsletter as well.
Yeah, absolutely. So, listeners, this is your call to take action. Start prioritizing yourself, even if it's just one small step today. Thank you, Dr. Buchanan, for
Thank you
reminding
so
us.
much.
You're welcome. That we need to take care of ourselves so that we can be better for our families, our business, our community, and our communities. If you enjoyed this episode, don't forget to like, share, and subscribe to Rise Urban Nation podcast. Let's build this movement of self care and wellness one story at a time. Stay tuned for our next week's episode. You don't want to miss it.